Good morning. We're going to go ahead and start lecture, and I'm going to share my screen with you for urinalysis. So with the urinalysis today, we're going to start, we've gone over the urinary system, and we've talked about the parts of the urinary system, and we've talked about each one of its jobs, the functions, and we've talked about the dysfunctions or the um, disorders and diseases and that can happen to the urinary system. So now we're going to move ahead and with the actual process of doing a urinalysis. We already know that our kidneys act as our filter, and they help clean our blood and remove waste and excessive um, water, and this is in the form of urine. We know that micturition is urination. Another term that a doctor might use is to void. The urinalysis test involves um, examining multiple aspects of the urine: its appearance, its concentration, and then the actual content, what's inside. This is usually done for three reasons. One, the doctor wants to just make sure everything's okay. And then two, to monitor ongoing medical condition or to see if there's a medical condition or like an infection or something. This test is very useful, very helpful for looking at diabetic issues, if there's too much glucose in the urine, to see if there's a urinary tract infection, and metabolic, of course, and endocrine other disorders. And another thing that they use it for is to see how well somebody's insulin is working, if they're new to taking insulin. The thing we need to remember as medical assistants is the integrity of your specimen is vital to the results of the test. Meaning that if you have a urine sample from a patient and it sets this in the regular temperature of the the lab or whatever, it can degrade the urine. And what it can do is it can actually cause crystals to form, bacteria to form. It can lose certain pH values that it needs to have for proper testing. So that lets us know that it is vital that when we get a urine sample, I always tell everybody within 5 minutes, if possible, of the patient giving you the sample, go ahead and run the test. I always say, get a specimen in a urine thing if it looks like there's an infection, because the doctor's going to want that. The doctor's going to want you to send that off, okay? And then remember that urine is something that has to be kept in the proper conditions. And we're going to talk about that. In most cases, samples are refrigerated if you're not going to be able to test the urine right away, and that can be, you should refrigerate it as soon as possible, and it can stay there for a few hours. Many times patients will be needed to be told how to do a proper urine specimen, and this is something we're going to cover. There's a minimum. Everybody always wants to know, how much urine should I put in this cup? And most of the time we get it all the way full. We don't need it all the way full, but we also don't want too little. In general, about 10 mLs is the absolute minimum, but I tell everybody, to be safe, always go for about a half of the cup. If you can get that much, that's perfect. In your book, it shows you the different types of collection containing kits that you have. And when you go to lab, you'll see those as well. Okay, so we have different types of urine test. We have a random. That means, just like it sounds, you walk in the middle of the day, no special drinking or eating of anything, and you just had a normal day, and you go in and you tinkle in a cup. Okay, that's a random, and it's used for lots of different, and it's most common that we'll do. And then there's one called a morning void. The morning void is going to be the very first urine of the morning. This is when we normally do pregnancy tests and stuff, because the concentration of the HCG, the pregnancy hormone, is been stored overnight, and it's at its strongest. And then there's another one called a time specimen. And that's where a patient, where they're usually wanting to check the chemical levels. I'm so sorry. The chemical levels of the specimen and what's contained in it. And we usually do that where we have them do it after they eat or before they eat, or after certain medications that they have taken, so forth. And then there's the 24-hour specimen. And this is usually something that is done. They send the patient home with a large jug and a containment collecting device, and all of the urine that they produce goes directly into the jug. And I don't know what to do. I'm so sorry. I had plenty of sleep. I think it's medication. The 24-hour urine specimen really helps doctors to be able to see exactly how their body's filtering and maintaining its homeostasis, its pH, and so forth over a 24-hour period. This is common for people who have renal disease, and this is common for people who are looking for kidney stones and stuff like that, because it's a good way to test the long-term, like a 24-hour value, instead of just a quick peek of what it is, like what we normally give at the doctor's office. And then there is the 2-hour post-eating, right? And that specifically is done to see if a patient, their insulin is maintaining, because if it's not, you'll see glucose is in such large excessive amounts that it spills into the urine, meaning that the blood can't absorb all of the sugar that needs to be intaken to the cells, so it's sent to the kidneys and we urinate the rest of it off. Now you'll notice I've already posted in Teams this video, okay? This video is a mandatory video you must watch, because this shows the proper way to instruct your patient and give them the right ways to do what's called a midstream clean catch. And what that is basically where we give them the little wipes in a cup. It comes in a package, and we teach them how we need to instruct them before they go in. If they're not familiar, you can ask them, do you know how to perform a clean catch? And if they say yes, then they're good to go. If they say no, then you would watch, like I said, the video tell you about how you need to use the 3 wipes and sanitize, if it's a female, the outside of the labias, and then the center wiping forward down, and then to urinate slightly in the toilet, and then place the cup, because it's a midstream. Like I said, the videos, both of these videos, for female and for male, do a very good job of showing and explaining how you need to instruct your patient. With men, for women, yeah, it might be a little uncomfortable because you don't want to ask them things, but there are things that you need to be able to be comfortable with. Same thing with a woman, telling her to make sure she cleans between the labia and down the, the starting from the front, working her way backwards. This is important. Same thing with the men. That way, I don't ever have to ask if a man is circumcised. I just start off by saying, if you are circumcised, you are going to go ahead and clean the head of the penis around in circular motions. And if you are uncircumcised, you're going to pull the foreskin back and clean the head of the penis. And that way I don't have to get too personal. They don't got to tell me more than I want to know or they want to tell. And then to tell them that once they have cleaned that, to maintain and make sure that the foreskin doesn't come back over the penis. And to pee and then stop and then pee midstream in the cup. Same thing, but slightly, slightly different contexts between the male and the female. Next, we're going to talk about catheterization. Now, when we catheterize someone, this means that we are inserting a small, flexible, and it's usually some type of plastic-like catheter, and it's inserted into the urethra, and it's lubricated and specially designed for the urethra, and there's different sizes. And the reason we do this is because we want to get a specimen that doesn't have any outside possible contaminants. So the nurse or the MA, doctor, whoever, I have seen some MAs who have been trained to do this. This is not something that we are trained, but I have seen doctors who do train their MAs to be able to perform these. And when you do this, it's something that has to be cleaned and sterilized around the urethra very well. And then the Foley is the urethra until it's advanced, and you'll notice that it goes all the way to the bladder. And then once in the bladder, there's a little port right here, and we fill that up. If we're going to leave it in there, we fill that up, and that makes a little air balloon to keep it from slipping out. Okay, and then there's a tube that collects the urine. Now, sometimes we don't do this to leave it in. Sometimes we do it just to get a sample, all right, to get that clean sample. They do this with pediatric patients because it's kind of hard to tell a baby, hey, baby, I need some urine, pee for me now. And so they'll do a Foley if they suspect that there are people have Foleys when you go into the hospital or you go into a surgical procedure, and that's so that you're able to urinate but not on the bed making a mess, that kind of thing. Well, especially with surgery patients. Now, there are different sorts of Foleys, and Foley is the type of tube that we use to catheterize somebody, just the tube that we put in the urethra. These are called Foleys, and a Foley means that it is indwelling catheter. Okay, and that means that's something that we usually think of as being in there for a short amount of time. And some people live with these. Some people have to have them replaced and take daily care of this, and it's part of their day-to-day lifestyle is that they have catheterization due to many reasons. But there are many different materials that they are made from: rubber, plastic, PVC, silicone, latex. So there's many options. The size, so the diameter is measured in something that is very unusual. Now, I don't expect you to remember the sizes and so forth, but I do want you to be familiar. If you're ever assisting a doctor and he says, hand me a 7 French. You're like, 7 French? What are you talking about? And basically that means he wants a 7 diameter Foley catheter. And because Foleys are measured, their diameter is called French. And it's abbreviated like here on the PowerPoint, FR. Men have longer urethras, so they usually have a longer Foley catheter. Pediatric catheterizations usually require 5 to 10, just depending on the female. I mean the child. Male catheterizations for like a full-grown adult is anywhere from 16 French to an 18 French, and females are 12 to 16. And you guess that is one of them by eyeing the size of the patient, by eyeing the size of the Foley that you have, and seeing what looks like it's going to be the best fit. You're not going to want to put something that is too large into a smaller sized person. Now there are other types of ways we can collect urine. I have seen this done in the ER actually a couple of times. And what it was from, one case was a woman who had been in a multi-vehicle, a bad car wreck, and her pelvis, especially the lower region of her body, was extremely mutilated, and they did what's called a suprapubic puncture, meaning they pulled urine from her bladder because they were afraid that her bladder was going to burst, and they were able to put like a temporary type of catheter until they were able to reconstruct and fix her genitalia. I've seen this also with a woman that was burnt. And then I've seen this with another incident of a really bad four-wheeler accident with a man. So those are the times that I've seen that. Now, sometimes they might do it when there's no injury or issues whatsoever. It's because maybe this person has had a urinary tract infection that is just so bad, and they want to make sure they're without a shadow of a doubt that there is none of this, what they think is infection, is coming from external, so that they'll actually do surgical procedure like to clean, iodine, betadine kind of thing, cleanse this area, and then perform the suprapubic puncture, so that the urine that they get is no chance of contamination. Okay. Now, when we're talking about urine has very specific characteristics. You, as an MA, you need to be familiar with these. Its appearance. When you look at urine and hold it up to the light, it should be clear, and you should be able to see through it. When you cannot see through it, the appearance, we would say that it was cloudy, or I'm so sorry, or turbid. Okay, cloudy, you might be able to see a tiny bit of light through it. Turbid, this term means that it is opaque. When you hold it up, there's no light coming through. Okay, this is usually because of infection and pus in the urine. And that term we've heard, that's pyuria. Pus in the urine because of infection, pyuria. So we want to always observe and write down the color and the consistency, the appearance of our patient's urine. If it is abnormal, that's when it's most vital. You always do this before it begins to cool, because if you don't, crystals begin to form, and we don't want that. This picture here shows you a healthy, clear, what we call straw yellow urine. This urine here, you see there's no light coming through it. It's turbid, it's infected, it does not look healthy. It is way too dense. The color, like I said, should be a pale yellow. Like I said, it's commonly referred to as straw yellow. But something you need to remember is that vitamins can commonly affect a patient's color of their urine and the smell of their urine, okay? And so if you see urine and it's kind of greenish or it's this or that, it's probably something that they ate. Now, we know that diuretics cause people to urinate. And some people who are on diuretics, their urine comes out completely clear. Some people who are just drink lots and lots of water, their urine will come out clear. And that's not necessarily a bad thing. Now, if it comes out dark or reddish, we should already know by now, because we've done a patient assessment, is my patient menstruating? Are they on their period right now? So if yes, then that's probably the reason that there could be dark reddish tint or hue to the urine. Now, if it's a male or they say no, they're not on their cycle, and we see this dark or red urine, that would be something to be concerned about, because that usually means bleeding, okay? And we do know that the hematuria, right? And we know that, like I said, some medications can cause urine to change. One of the most common is a drug called pyridium, and that's right here. And if you work for a urologist or a gynecologist even, a lot of women get urinary tract infections. And one of the things that come along with that is pain and bladder spasms. And pyridium is wonderful because it's all it is an actual dye, but for whatever reason, this dye has a very muscle relaxing effect on the bladder. So it helps release and relieve the patient of those bladder spasms. But the side effect is it turns, because it's a dye, it turns the urine either bright greenish blue or bright orangish. So it's like, where the heck did they get that color? But that's what it's from. I've even seen people who, if you've ever had a birthday cake and the frosting was the type that when you ate it, it turns your teeth, right? Certain food colorings that they use for frosting will also have an effect on your urine. So I've seen people say, my urine was kind of purpley blue. The first thing I ask is, have you recently been to a birthday party, had any cupcakes or cakes with that color of icing? Oh yeah. Now, like I said, females may appear bloody, but usually the only time you're going to see that is if they're on their menstrual cycle. Okay? This is one of the last things that I want to cover with y'all, is what your pee says about your health. If it's clear, you might be too hydrated, or you might be like on diuretics. If it is pale yellow, you're well. You're nice and hydrated. If it's dark yellow, this means that you're definitely dehydrated. It's not good. Brown means that there is old blood in the urine, or there's an infection of the liver or something like that. Red or pink, blood, but there, like I said, that could be from a couple of reasons. Like I was telling you, my husband, after he had his stent placed from his kidney stone, he urinated blood for a while. Women on their menstrual cycles are going to urinate blood. So it's not something to be necessarily alarmed about, but it's definitely something that you make note of on their urinalysis sheet. And then, of course, blue, green, etc. This can be, like I was telling you, food coloring and types, and also medications and supplements. Okay? And we are going to stop there. And I know that there's a lot of people out, so just try to work on any work that you're missing, including your project, and let me know if you have any questions, okay? Thank you. Oh, let me get attendance. What do we have here this morning? Participants, yes. Erica, Kiki, yes, very good. Just the three of you. Okay. All right, thank you guys. Have a wonderful day. Bye.